Welcome. Thank you for joining us today. I'm Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General. Today's webinar is part of our Nutrition During Cancer Treatment Education Series, a special collaboration between the Blum Center and Mass General Cancer Center. Before we get started, I just want to go over a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Please note that everyone's in listen-only mode. Everyone has music and hear our guest speakers today. If you have any questions for our guest speakers, you may use the chat feature, which is located at the bottom of your screen. We'll have time for them in the end. Only Blum Center staff and our guest speakers will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you to help us complete. Your feedback is important to us as we plan future programs. All right, so next I'm going to turn it over to Rob Dunn, who will get us all started.
Fantastic. Thank you so much, Amy. My name is Rob Dunn. I am the Clinical Nutrition Manager at the Mass General Cancer Center. I am super excited to be here today presenting alongside my colleague, Martha Silva. Martha is a registered dietitian who joined the Mass General Cancer Center in 2023 after completing her dietetic training at the Brigham and Women's Hospital. Both Martha and I care primarily for patients undergoing active anti-cancer treatment. And we are excited to present to you today on managing nausea during your cancer treatment course. I will pass it to Martha now, who will lead the presentation, and I'll be back at the end to help answer some questions.
Great. Thank you so much, Rob. Appreciate the introduction, and just give me a moment, everyone, as I share my slides. All right. And let me just get this in presentation mode. Is that showing up for you, Rob and Amy?
Yes.
Okay, fantastic. So as Rob noted, today we're going to discuss managing nausea during cancer treatment. Here is our agenda. We'll start with a brief overview of nutrition during cancer care and then delve into understanding nausea, cover some dietary approaches to management, and finally, we'll share some practical tips and tricks that can be applied over a typical day. Nutrition and cancer care. Our team of registered dietitians works with patients, their families, and their treatment teams to help manage the side effects of treatment, including nausea, develop individualized diet and hydration plans based on patient preferences and different dietary restrictions. We help recommend oral nutrition supplements, including Boost, Ensure, and Kate Farms products, to name a few. We try to prevent, identify, and treat malnutrition, guide tube feeding support, and finally counsel on nutrition for wellness and survivorship, in part through the hospital's lifestyle medicine program. So let's get into understanding nausea. Nausea is an unpleasant, queasy feeling that typically presents in the upper abdomen and may lead to vomiting. For some people, it may lead to dry heaving, which is the action of vomiting, but no contents are ultimately expelled from the stomach. And nausea arises from a complex number of signals that travel between the gut and the brain in response to different stimuli. That might include motion, for example, from being on a boat or in the car, infections, typically of the GI tract, and chemotherapy drugs, as well as other anti-cancer treatments, for example, radiation therapy. Cancer treatments may have what is called a high emetogenic potential, which means that they're likely to cause nausea and vomiting, and that's why you may hear anti-nausea medications referred to as antiemetics. They counter that emetogenic potential. Chemotherapy-induced nausea and vomiting specifically affects up to 80% of patients during treatment, and nausea arising from chemotherapy as well as other treatment agents can be classified in a few different ways. Acute nausea typically presents within 24 hours of treatment, whereas delayed will arise over 24 hours after treatment. Anticipatory nausea often presents prior to treatment and can be brought on by environmental triggers like the sights and smells associated with the chemotherapy infusion. Breakthrough nausea occurs within 5 days of that treatment date, despite the use of traditional anti-nausea medications, and it may require what are sometimes known as rescue medications that go beyond the standard line of medications initially prescribed. And then finally, refractory nausea tends to push through all of those medications that the treatment team is able to throw at it and present in future treatment cycles. So the treatment approach may vary based on what type of nausea is affecting that specific patient. There are a variety of different risk factors that may make someone more or less likely to experience nausea during treatment. The first is that emetogenic potential of different drugs. Some are notorious for causing nausea. The second might be the dose, with higher doses of anti-cancer agents typically correlating with an increased likelihood of nausea. Treatment schedule and combination therapy can also make a difference. So if, for example, a patient is receiving multiple treatments that have low emetogenic potential, they can compound when given together and increase the likelihood of nausea. Age is a risk factor, with folks under 50 years old being more likely to experience nausea, and sex is a risk factor as well, with females being more likely to have nausea during treatment. History of motion sickness or morning sickness during pregnancy are other risk factors. And finally, dehydration and malnutrition. These are important to note from a nutrition standpoint because they can create a quite challenging cycle where the presence of nausea makes someone less likely to drink fluids or eat food. And then that dehydration and lack of something solid in the stomach makes the nausea worse, and the cycle repeats itself, creating a bit of a perfect storm. Beyond chemotherapy, there are some other risk factors during treatment. Constipation can lead to feelings of fullness, pressure, bloating, and abdominal discomfort, and that can exacerbate nausea. So it's particularly important if someone is experiencing both nausea and constipation to address both of those symptoms. Tumor location, particularly tumors of the GI tract, liver, or central nervous system, can lead to an increased likelihood of nausea. And then finally, for folks receiving radiation, total body irradiation or radiation specifically to the upper abdomen and the craniospinal regions can increase the likelihood of experiencing nausea. A lot of progress has been made over the past decade in terms of the different pharmacotherapy options to both prevent and treat nausea. There are a variety of different medications that might be offered with different treatment regimens, and the medication prescribed will often vary based on the root cause of the nausea. A few common ones that patients often receive are serotonin antagonists like Zofran, dopamine antagonists such as compazine, and corticosteroids, including Decadron and prednisone. These are sometimes given in combination as a preventative. For example, a steroid like Decadron might be given with a serotonin antagonist like Zofran. The key takeaway from this slide is that it's very important to take anti-nausea medications as prescribed and to follow the schedule laid out by the treatment team, because these agents can help get ahead of nausea and they can be used in concert with some of the dietary approaches to management that we'll discuss now. First, food selection and frequency really matter when it comes to nausea. Eating smaller, more frequent meals can help reduce nausea, particularly just having something solid in the stomach may help dampen those signals that are sent from the gut to the brain, indicating nausea is present. Bland, starchy, and salty foods tend to sit better than anything very greasy, fried, or very flavorful. And drinking fluids in between rather than with meals may help. This can also help increase how much food is eaten at a given meal and help keep lean body mass intact, because occasionally folks will fill up on fluid if they're taking that in with a meal, and that can exacerbate weight loss. And then finally, clear liquids like broth or juice without pulp can be easier to tolerate when nausea is very strong compared to fuller and thicker liquids, things like smoothies, dairy-based products, although that certainly does vary person to person. On the behavioral side, taking medications, as long as they're appropriate to take with food, with again, something starchy or salty like crackers can help to settle the stomach. And timing meals around when antiemetics are most effective can be a helpful strategy. For example, if nausea tends to peak later in the day, um, really capitalizing on that breakfast and lunch meal and getting in some good calories and protein at that time can be one possible workaround. Staying upright after meals can help keep the bowels moving, and light walks as able during the day can be beneficial as well. And then for anticipatory nausea specifically, that nausea that might present in anticipation of a chemotherapy or radiotherapy session, there is some evidence that progressive muscle relaxation and meditation techniques with guided imagery can help. There are some other complementary therapies being investigated as well in that realm. And then if food odors are a problem, avoiding cooking odors as much as possible can help. This might look like having someone else prepare food if that's an option, or at the very least, opening windows to increase ventilation in the kitchen during meal prep. Avoiding other strong odors that might then cause the stomach to turn, like perfume, air fresheners, anything very off putting, can help as well. And finally, serving food that is either cold or at room temperature can help reduce those food odors and improve the overall experience at the meal. There's some evidence that specific nutrients may be beneficial to help with nausea. We say potential role because a lot of these studies are still emerging, or the evidence we have comes from a handful of studies, so we don't have as strong an evidence base just yet. However, with these options, lemon, ginger, mint, the risk of any harm is often quite low and they're available at the grocery store. So these can be something that's easy to try. For lemon, it can be added to water, consumed in the form of tea, lemonade, different sports drinks like Gatorade often come in a lemon lime flavor. Some people find sucking on lemon drops helpful to stimulate saliva production and get a more pleasant taste in their mouths. And there is one study that showed lemon aromatherapy may be beneficial. In that specific study, patients were instructed to slice a lemon into a wedge and then smell it with their eyes closed for 15 seconds before meals. Ginger may also be beneficial. Ginger candies, hard candies, as well as chews can help. Ginger tea and ginger ale could be other options. And grating ginger onto food or adding it into soup could be an option as well. And then finally, with mint, can be added into tea, water, or used as a garnish. And these three flavors pair quite well all together. So adding lemon ginger mint to a single tea or to water could be an option as well. Another recent study, this was a meta-analysis, so it pooled the results of multiple different studies, found that supplementation with fatty acids, specifically omega-3s, and then probiotics and ginger were all found to reduce nausea for patients with GI cancers receiving chemotherapy specifically. I will say that certain supplements may be contraindicated with specific treatment regimens. For example, it may not be appropriate to take a probiotic supplement on specific immunotherapies. So it's always recommended to discuss any new dietary supplements with the treatment team before adding them on to ensure that they're safe and not contraindicated with care. Let's now put this all together and consider what a typical day might look like, weaving in some of these recommendations. First, take medications, including antiemetics, as prescribed. This will often start on waking. And if it is possible to take all medications with food, occasionally a medication may need to be separated from eating. Having something like crackers right at the bedside that can be snacked on even before getting up can help just get something solid in the stomach. And then start the first mini meal separating liquids with sips before and after. Try to stay upright, even if it's upright in a chair, for at least 30 minutes after eating, and include light activity during the day as able to help keep the bowels moving. For mini meals specifically for nausea, we've made a list here that pairs something starchy with a cold protein source and then a fruit or vegetable to balance things out. So that might look like oatmeal with a nut butter and some apple in the morning, some crackers with chicken, egg, or tuna salad, which would all be refrigerated, with some baby carrots a few hours later, pita chips with plain hummus and celery as a snack, might be a turkey sandwich in the evening, something just not too overpowering, and then some granola, Greek yogurt, and blueberries later on. But this pattern could certainly be adjusted based on dietary preferences. And if food odors aren't a problem, no need to include a cold protein. A warmer protein source that's been cooked and served would be perfectly fine to have. Lastly, going back to the clear liquids, occasionally drinking calories can be a bit easier when appetite is very low. And so here we've listed out some clear liquids that might sit nicely if nausea is quite strong. From the grocery store, clear liquids could include chicken, vegetable, or beef broth with the option to add ginger to get that potential benefit, strained pulp-free fruit and vegetable juice, ginger ale, a sports drink in that lemon or really any tart sour flavor should help get the saliva going, pulp-free popsicles, and then lemon ice. For example, the Italian ice cups could be an option. And in terms of oral nutrition supplements, Boost Breeze, Boost Soothe, and Ensure Clear are all clear versions of their heavier supplements that tend to come in fruit flavors like apple, berry, strawberry, kiwi, etc. We do encourage patients of the Mass General Cancer Center to schedule appointments with our team of dietitians for specific guidance so that we can really get into any individualized needs and recommendations. And so those referrals are always available by speaking with the oncology team. And we do see patients in Boston, Danvers, Newton Wellesley, and Waltham, as well as virtually. Thank you for listening, and we can take any questions now.
Awesome. Thank you so much, Martha. I thought that was really, really well laid out. I am selfishly very glad that you included the lemon aromatherapy part. That's something I've been really talking to patients about a lot recently for chemotherapy-induced nausea and taste changes as well. I feel like that's like an exciting, very low risk, low cost intervention that people can do themselves at home. The one question I wanted to pass along was the you might suggest that patients navigate kind of shifting away from hotter foods when they have like a cold sensitivity in relation to some of the treatment that they're getting?
That's a great question. And certainly one of the more challenging aspects of balancing those two symptoms together, the cold sensitivity and the nausea, that's where serving something at room temperature may be the best option. And it's not always possible to have someone else prepare food for you, but if there is someone available to help, having them make the food and set it out and waiting about 20 minutes before entering the kitchen could be an option just to let it cool down a bit. But certainly, if you do need to prepare it yourself, if you're able to open a window, set it down, and then come back within 20 to 30 minutes, it would be perfectly safe to eat that food then. So that can be one kind of quick workaround that doesn't require modifying the things you're eating already quite as much.
Awesome. Thank you. Thank you. There's another question in here, and I can start by answering this one, and then I'll ask you for your feedback. The question was in regards to continuing use of GLP-1 agonists and other kind of targeted weight loss medications. And I guess in context of anti-cancer therapy, if it's possible to do that. Because these medications are relatively new, and a lot of the cancer therapies that we're offering at our center are also relatively new. This is very much an individualized question that you should discuss with your oncologist. I've cared for patients who continue to use GLP-1 agonists, during their anti-cancer treatment. That often is when they're using it to manage their diabetes, as not just purely for weight management purposes, although there may be some cases where GLP-1s prescribed solely for weight management could be continued during anti-cancer therapy. Always our North Star is to keep you well nourished, well hydrated, and strong enough to undergo the treatment your oncologist prescribes for you. And if those medications start to pose a barrier to that, it may be something that we in conversation with your oncologist recommend that you discontinue. But there's not a one size fits all answer to that question. Is there anything you'd add to that, Martha?
I don't think so. I agree. I have cared for patients who continued their GLP-1s on treatment, but that certainly is at the discretion of the oncologist. And then we really take it from there on the nutrition side.
Awesome. And then another question from the chat is, are there any tips for any tips while vomiting that you can share? So I'm interpreting that to mean for patients who are not just nauseous but are actually experiencing episodes of vomiting, what advice might you give to them? And I can start. I think that the first thing I would recommend if you're actively vomiting, is to replace the fluids that you're losing through your emesis or your vomit. So using an electrolyte-rich beverage, something like a Pedialyte, a liquid IV, something that has not just added sugar, but added sodium as well to replace some of the electrolytes you're losing while vomiting. And then to call your doctor's office if you're vomiting more than 2 times in a day. That really is not something that you should be sustaining without some medical supervision. It's not always dangerous, but it's definitely something you're going to want guidance from a professional on. Would you add anything to that, Martha?
No, I agree. And actually, I'm glad someone asked about the vomiting because, to your point, Rob, one of the reasons we didn't really go into vomiting recommendations specifically is because that is a concerning enough symptom if it is happening on a regular basis that we would then get the rest of the treatment team involved to help do further workup and manage it appropriately. So that goes beyond our umbrella of dietary approaches typically.
Yeah. I definitely think that what's important there is making sure in the short term that you avoid kind of acute underhydration. And so if the vomiting is recurrent, you want to make sure you're drinking enough fluids and including electrolyte replacement to avoid kind of symptoms of underhydration. Um, and then just one last comment, because I think you really summarized this very well, Martha, is that vomiting or nausea management does require very often a root cause analysis to understand what the underlying factors driving your nausea are. So sometimes that's the medications you're prescribed, sometimes that can be constipation, and working with a registered dietitian or other members of your care team can help you kind of identify what's driving your nausea and what interventions might be the most impactful to reverse it. I'm not seeing any more questions in the chat. We have just 2 minutes left.
While we wait to see if there are any additional questions, what I can do is save the date. I'm going to drop in the chat our flyer for our series for anyone
Perfect.
interested. Our next session will be on Monday, November 3rd, same time at noon, where we'll be covering managing poor appetite during cancer treatment. I'll also include the link to the website, because once you go to the Blum Center website, there are actual like direct Zoom links you can click on to join. So I'll put that all in the chat.
Fantastic.
And this link that I'm sharing will take you directly to our page regarding the Nutrition During Cancer Treatment Education series with all the links and details of our future sessions. So I don't believe there are any additional questions in the chat. Before we end, Martha, Rob, do you have any final thoughts you'd like to share with the audience?
I would just say thank you all for attending. We are available to you if you're a Mass General Cancer Center patient. Feel free to reach out to your oncologist to ask for a nutrition referral. As Martha said, we are available to meet with you on site at any of the 4 treatment locations, as well as through virtual visits.
Wonderful. Well, thank you both. This is extremely helpful. And for everyone joining us today, thank you so much. As I had mentioned, today's session is being recorded. If you're interested in viewing the recording, it'll be made available on the Blum Seminar website at massgeneral.org/Blum-Center. Thank you, everyone. Take care.